good morning and welcome to a special year in review edition of UroPatient. Today we're looking back at the stories that mattered most in 2025, the conversations that changed lives, and the breakthroughs that help patients feel informed, empowered, and heard. This is the best of UroPatient 2025. But first, maybe a quick history lesson. So UroPatient came out of UroNurse, which I started 3 years ago, as a way of reaching out to healthcare workers for education over the internet. Because streaming was becoming more and more popular, this was the way that people preferred to learn. So I decided to start UroNurse. But I did find out pretty quickly that a lot of patients, like yourselves, were watching it. And it really wasn't aimed at you and specifically, so I thought, hey, why not start UroPatient? The UroPatient podcast then came out next. And it has been beyond my wildest dreams at how successful it's been. And we'll talk about that in a little bit. But it was a great way to reach out to patients and provide patient education. You know, something I spent a 40-year career providing. So it was only natural to continue on as I hit my retirement to do this virtually with everybody. And you're going to see it's a wide audience. Of course, the challenges are always there. I love doing research, or reading research, I should say. And so I did start something called UroNurse News, which is based on research. I know a lot of it's urology based, some of it's not. And I've noticed a lot of people are watching some of these. They're little quick 5-minute updates. You can check any of these podcasts out. They're all available through UroPatient. It has connections to all of them. And then, hey, a buddy of mine also getting close to retirement, Dr. Jeff Albaugh, who's a sex therapist, decided that we should collaborate and start a podcast on sex and intimacy. So you can always check that out too if you want to learn a little bit more about love. So this year, one message rose above all others. Patients want answers. They want honesty, and they want their concerns taken seriously. Some of our most watched episodes tackled questions many patients are afraid to ask. Now, I thought I'd share some interesting facts in just the 2 years that we've had. And one of the biggest things was how many views people have, watched this show. And it's almost 750,000 views, which is pretty crazy in 2 years that I've had that kind of viewership. But hey, keep it up. I love doing it. Now, the other thing that was kind of insane for me that I didn't realize until I started doing this is the reach that it has. It's actually viewed in over 50 countries. And actually, I went through and looked up and counted. It was actually 54 countries throughout the world. I think there's only 100 and some odd, countries in the world. So almost half the world is tuning into UroPatient, which is just, as I said, mind-blowing to think that we've had this kind of reach from a little program about urology education. It's a small little niche audience. Now, I guess most of my viewers would be older, which kind of makes sense because most of these problems tend to pop up when you're older. But I was surprised by that 25 to 34-year-old group that's watching it. It shows that all of us need some help with our tackling urology problem. Now, here's the top 10 episodes, and I think it's kind of crazy if you look at what the top 5 were. They're all about catheter care. So it shows definitely that there's a need out there. And I suspected that when I started seeing the number of people that were watching and some of the comments that I received over on UroNurse showing that it was patients that were watching this. The busy urology offices are just that. They're busy. The doc's trying to get patients, in and out so that you don't have to wait a long time to see the doctor. And there's a limited number of urologists out there. So sometimes the education component, I think, is getting lost, especially the really necessary stuff. And so now it's no longer lost. Just tune into UroPatient. We'll talk about everything that you need. And if we don't, ask me. I will. So when we look at some of these episodes, this is what the real things that kind of jumped out at me. Can my catheter fall out? What really happens after prostate surgery? Is this normal or should I call my provider? These aren't just popular episodes, they were permission slips. permission for people to ask, permission to understand, and permission to advocate for better care. And one of the ways I really learned how important this is was through the comments, and I read all of them. And here's a few of them that I came real patient comments that came out. Thank you so much. I just tried this on my baby's catheter and it worked right away. Talked about how to unblock a catheter. I had a suprapubic catheter for 3 months. It's been painful the whole time, irritating my bladder. What could be going on? Questions asked. I'm a potential candidate for HOLEP, and I found this very informative. Thank you. So you can see that all these things are helping people out that aren't getting the knowledge they needed, but they have a place now. One powerful lesson really stood out in 2025, and that was education reduces fear. When patients understand why something is happening, they cope better, they recover better, and they feel less alone. So that's what we're here for, make you feel less alone. Across the year, we heard it again and again, from bladder health to sexual wellness to post-procedural recovery. Clear information changes outcomes. And at UroPatient, that's more than just a statement, that's a mission. We think that by educating you, you'll have a better outcome, and education equals, like it says, empowerment. So 2025 also brought some meaningful breakthroughs. We explored new approaches in patient education, better explanations of technology, and practical tools patients can use at home. We've introduced a bunch of them. From innovations in catheter management to improved conversations around intimacy and quality of life, these weren't just medical advances. They were human advances, because treating the condition is only part of the story. Treating the person matters just as much. I always found that true. You know, if you can show care, patients will respond to that. I know I've been a patient myself. It makes a big difference when somebody actually cares about you. So if 2025 taught us anything, it's this. Patients don't want to be talked at. They want to be talked with. They don't want jargon. They want clarity, honesty without fear-mongering, and guidance they can trust. That's what UroPatient strives to deliver. Every episode, every topic, every time. So as we look ahead to 2026, my commitment remains the same: to bring you trusted voices, clear answers, and conversations that put the patient first. Thanks for watching. Thank you for learning. And most importantly, thank you for taking an active role in your health. From all of us that help put UroPatient together, I'm Vic Senese, and hope to see you for the next year with more UroPatient.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your health for you and me. Knowledge is power, power. We make it clear every Saturday morning. The podcast is here.